Erica Tockhart. I'm sure by now you know New Zealand excels at a game called rugby. Today we're going to show you something else we do very well. Thinking, creative ideas, constant innovation. Meet Tu Maniapoto, father of 3 and passionate rugby supporter. Tu is also prone to the acute arthritic condition gout.
I was 18 when I had my first attack.
Gout causes pain and damage in the joints, the toes, ankles, elbows, knees and fingers. But gout is very treatable. Both the pain and damage can be controlled and prevented with careful management. Today, we're going to show you how smart IT solutions are working at the front line of healthcare to help support doctors, nurses, and above all, patients like Tu.
When someone like Tu presents to hospital, we use clinical information systems to help us identify where Tu is, how quickly he needs to be seen, his triage category. In addition to that, we need to gather information on what he's presented with, what his medications are, and that's supplied to us by the clinical information systems which link with community information from pharmacies and general practices.
The pharmacist will do a medication history and they use the online tools to access what's being dispensed in the community. These online tools improve patient safety because they help to reduce emissions of their normal medicines, and it makes sure that we give them the right dose while they're in hospital.
A month later and Tu's gout is stabilised. Now the full power of healthcare connectivity comes into play.
Kia ora, Tu. It's great to see you again today. We've got a great new tool that we can use called InPrescribing. So what that means is when I do your prescription here, it'll go straight through the pharmacy and be ready for you to pick up. It's really going to improve communication and coordination, and safety and the quality of care that we can deliver. Well, I'm really excited about the benefits for us as clinicians around these tools, because it means that we can ask for advice or an update from other people in the care team for patients such as Tu without having to play phone tag with specialists or write a formal referral for him to be seen.
With this care plan, it gives you access to the current list of medications, the current diagnoses, and there's also the ability for you to send me a task, or perhaps you want to have a chat to Peter Gow about something to do with your gout.
It resonates instantly with patients. I don't have to explain it. They can see the transparency, they can see the opportunity of their involvement, they can see the speed of communication. Yeah, it's fantastic.
And there's just a couple of things about your medications. I think it might be good if we just reconnected you with Dr. Gow at the super clinic, and sometimes he can actually just look at the information and give us some advice back without actually having to see you at the clinic.
I've got access to the discharge summary that he had when he left hospital. It also looked at the medication that he was on when he came into hospital and what had changed when he went out, and that's safe for him and it's safe for me. I've been able to look at the level of his uric acid to see whether the medication's been controlling him, and I've had access to his x-ray because that shows that there's some wear and tear in that joint, which is probably why his knee is affected more than other joints. Well, the benefit to Tu and other patients is that they're going to get a coordinated care for them, which will mean that we're all working to the same plan.
Internationally, in terms of the levels of innovation and the progress that we've made around health IT adoption, we're considered to be second only to Denmark. And increasingly what we're seeing is countries like the United Kingdom, Australia, Canada and the United States and others are looking to services and solutions that have been developed in the New Zealand health system and how they can deploy those in their own countries.
Using these tools is certainly better and safer, but it's also more productive, so everybody wins.
I control my gout now. For so long, gout controlled me. I wanted to be that dad with my kids that I couldn't be. I wanted to go swimming with them. So with that, I was able to design and have my GP actually care about that. and the nurse and the specialist actually all think on the same page as me. That's what I wanted, a better quality of life for me and my family.
That's just a snapshot of the partnership between healthcare and the health IT industry here in New Zealand. If you'd like to know more about the smart thinking and innovation behind New Zealand's health IT industry, you can visit us online at this address. Thanks for watching.